Good afternoon. Of course, I'm Jim Donchess, mayor here in Nashua, and I'm here with Bobbie Bagley, Director of Community Services and Public Health, to update you regarding the COVID-19 situation here in Nashua. Now, the bottom line is that the number of cases and the amount of transmission has gone up a lot. And you're going to see those numbers in just a few minutes. So we want you to continue to be careful. It's important to get vaccinated. This is definitely a protection against the disease and especially the severity of the disease. But also wash your hands, wear your masks, and try to stay away from large crowds, especially indoors. Now, maybe the silver lining is that there are projections done at the University of Washington and elsewhere suggesting that we are going to have a very steep peak, which we are approaching right now, but that there could be a significant drop-off in the next month or 6 weeks as we head into springtime. So assuming those projections are correct, and they have been so far, they projected a big peak right about now and in February, we may have some sort of a light at the end of the tunnel, at least with respect to the Omicron variant. So that's something hopefully we can look forward to. But before we get you the numbers, I wanted to mention one other thing. Our hospitals are at maximum right now. They're working very hard. Our healthcare workers, our nurses, our doctors, everyone working in the hospitals are giving 100% and more to help keep our community safe. As of Monday, there were about 60 people in our hospitals with COVID-19 between Southern and St. Joe's. This is about as high as it has been. And the problem that creates is that there aren't room for as many other people as we would want. People with heart attacks or strokes, they still need to get into the hospital and get treated. So we don't want to get into a situation where people with very serious conditions like those who need immediate treatment can't find room in a hospital to get treated. So we are working with the hospitals to try to help them. One of their biggest issues is shortage of staff. And so we talked with our police and fire departments to make police officers and firefighters available, if needed, on what we call a detail basis. They would be hired under normal detail rates to go in and help out if that's necessary. But we hear from the hospitals that they've gotten some good news in the last week or so. A number of staff members who were in isolation or in quarantine have returned. And number two, help has come from outside. The National Guard is providing people at St. Joe's and will be providing people at Southern. And in addition to that, FEMA is helping out as well with clinical support, which is very, very important. So we give our best to everyone working in the hospitals. I mean, having talked with nurses and doctors, I know that they're exhausted, and both physically and sort of mentally from the stress of this 2-year epidemic. So we really owe them a big debt of gratitude. Now I wanted to show you the first slide, and I will be just covering kind of the Nashua situation, and Bobbie will be talking with you about kind of the broader picture and about some preventive measures. But the first slide is the title is COVID-19 Data Update, Nashua. Now you see that we now have 1,581 active cases. This is a lot of cases. Back in the summertime, that might have was well below 100. The new infections per 100,000, that is 2,800. It's a kind of a basic measurement that is used to determine the amount of community transmission. That number has been going up steadily over the course of the last month or so. It was 1,500 2 or 3 weeks ago, and at times it's been way, way down to 100 or so again during the lull in the summertime. The positivity rate, 31%, 31.4, very high, double what it was the last time there was a peak about a year ago. So there's a lot of people out there with COVID, and now we have seen 120 people, 120 Nashuans die. Each death, of course, is a horrible thing for a family, and often these fatalities occur in a hospital where maybe visitors aren't allowed because of COVID. So these are families that have gone through a great deal. In terms of the vaccination data, we have 53% fully vaccinated, and 60% of Nashuans have received at least one dose. One thing we'd like to encourage is that the juveniles, the young people, 5 to 19, who are now eligible for vaccine should get vaccinated. We think a lot more of those young people should be vaccinated now than are, and so we really encourage all families to look into that with your medical provider, your doctor, to consult with them regarding deciding to go forward. But 53% is a little higher than it was. But again, given what's going on, vaccinations are critical, masks are critical, and washing hands and all of the other safety measures you'll hear about from Ms. Bagley are very important. The next slide is COVID-19 active cases in Nashua. This gives you a graph of the number of cases. Active cases now, you can see, is at a higher level than it has ever been before. Even at the March peak or the winter peak of last year, 2021, the number of active cases, now I mentioned it's 1581. Number of active cases was far less than now. And this just underlines the point we've been making. COVID-19 is definitely out there in Nashua, and we need to continue to be careful. The next slide is entitled COVID-19 Data Update Children. We've seen a lot of spread, a lot of virus in the Nashua schools. Earlier in the month, we had 443 cases early in January among school children, and there were 680 cases reported in December. Now, the 443 is only through the first week of the school year. The 680 for December was for the entire month. This week, school has been closed for at least 2 days because of the number of students and teachers who are out. There are 200 teachers out with COVID-19 or that are in isolation because of it. And in December, you see that there were 750 total cases of children 0 to 19, including those too young for school. And the last statistic saying that nine schools have reported new clusters in December. Most of them public, but one private school as well. So you can see that COVID is with us, at least at a high level, at least for the next few weeks or month. Again, we just continue we need to continue to be careful. If you have any questions about COVID or about testing or anything else, you can contact Nashua Public Health, Bobbie Bagley, or the Chief Public Health Nurse is Kim Bernard. They are available, and their staff as well, for any questions or help that you may need. So that gives you an overview of the Nashua situation, and now I will ask Bobbie Bagley to come up and help inform you regarding some other information that is helpful to know. So thank you, and Bobbie will be here.
Thank you, Mayor. And good afternoon. I'm Bobbie Bagley, the Director of the Division of Public Health and Community Services. And I'm going to give you the situational update of what's happening globally, nationally, and what's happening statewide as well. Let's cover some other information. So on the slide that you see before you, This is the global update, and currently there are over 300.3 million cases totally globally, and the deaths are up to 5.5 million. COVID has increased tremendously and continues to rise across our country as well. In the United States, the total number of cases is up to 63.2 million, and we've had over 842,000 deaths. For our state of New Hampshire, we continue to see substantial spread across the state. We have been having record number of cases reported throughout all of the counties. The total number of active cases statewide is 20,458. That is a record high number. The total number of cases in the state since the pandemic began is at 229,373. The test positivity rate is also higher. It's at 21.4%. And this, again, is one of those numbers that we like to see down at 5%. The expectation over this holiday period was that we would see an increase in cases. However, this is exponentiated far above what we were expecting. The total number of individuals that are currently hospitalized in the state of New Hampshire is at 415. And this number does create a problem for our hospitals across the state. Our total number of deaths have also increased to 2,032. And we do wish our condolences to the families that have lost loved ones to this disease. In the greater Nashua area, we also continue to see substantial transmission. The total number of active cases is at 3,361, and new infections per 100,000 at 2,460. The test positivity rate for the greater Nashua area is 29.7%, and the total number of deaths for our region has been 251. So we are seeing that at this point in time, we are learning that Omicron variant is now the most prevalent variant affecting individuals in our state as well as across the country. It is highly transmissible, and we're learning that it's not as virulent to many people, but there are individuals that this disease can cause hospitalization and deaths, and so we want to prevent as much as we can. Our vaccine data update shows us right now in New Hampshire at 56% fully vaccinated and 62.6% with at least one dose. Now, one of the numbers that we're not able to capture as concisely as we'd like to is the number of boosters. And so we're now going to be looking at completed vaccine series, including booster doses as well. In the greater Nashua area, 53.3% are fully vaccinated and 59.8% have received at least one dose. And we're hoping to see, again, the number include our booster doses as well once they learn how to track that. On this next slide, you can see the vaccine cases and the vaccine trends in the state of New Hampshire. And again, this graph is very telling. You can see the extremely high number of cases that have occurred over the holiday period. And our goal in putting our mask mandate in place in Nashua was to slow this down with transmission because of the amount of virus that's in the community. And so we still need folks to be vigilant about their mask use because there's so much infection in the community, and this will help slow the spread of exposure to others. COVID-19, our total number of cases by age in New Hampshire. This slide here is really important because this is allowing for us to see the number of increases in the age groups. And you can see here 16.2% in those that are 0 to 9. A huge increase has occurred in our 10 to 19-year-olds at 20.9% right now, and 20 to 29, 23.5%. So you're seeing increases across all of the age groups, but the major increase is occurring in those that are under the age of 50. And again, this is where we want to really do our due diligence with the vaccinations and getting those that are now age qualified to get vaccinated. And now I'll go to that next slide. Isolation and quarantine. This is really important right now. The CDC has put out some guidelines that change the isolation and quarantine period, and the state of New Hampshire has adopted these guidelines. And we're very specifically looking at close contacts of those individuals in the household. And so isolation is defined as that time that you isolate yourself from others in your household and not leave your household if you have tested positive for COVID. And this is regardless of your vaccination status. So if you're sick and you've tested positive, you do need to stay home for 5 days and you need to isolate. The only time that this has been given any changes is for healthcare workers, and that's only if they are not showing any symptoms that they are allowed to work. For everybody else in the community, if you test positive for COVID, you need to stay home for 5 days. After your isolation period is ended, if you are fever-free and you don't have symptoms, you can go back to work, but you will need to wear a very well-fitted mask for the remaining isolation, after the isolation, the remaining time of 10 days in total. We're also asking folks not to travel for 10 days if you've tested positive, regardless of your vaccination status for COVID. Quarantine is different. So quarantine is if you've been in contact, close contact. And again, in New Hampshire, we are defining this as household contact with someone that has been diagnosed positive for COVID. If you're fully vaccinated, and fully vaccinated means including your 2 doses from your primary series of the mRNA, which is Pfizer or Moderna, or your 1 dose of Johnson & Johnson, you do not need to stay home if you have also received a booster. So if you have not received the booster, then you do need to stay home. You need to watch for symptoms, and you need to wear a well-fitted mask for 10 days. And you need to get tested 5 days after exposure. At any point in that 10-day period, if you develop symptoms, you do need to isolate. So right now, COVID-19 vaccines, which there has been many studies that have proven that it's safe and effective, is now offered to individuals, our children that are 5 and up. We're also encouraging, and the CDC has approved booster shots for individuals that are 12 and up as well. You're eligible, or your child is eligible for these vaccines, the booster in particular, if they've completed their Pfizer or their Moderna vaccine series at least 5 months ago. And if they've received their Johnson & Johnson, J&J Janssen shot at least 2 months ago. And so this is for the booster. And the booster recommendations is only for those that are 12 and plus. So those 5 and up, go ahead and get them started on that primary vaccine series. Contact your healthcare provider, your local pharmacy, or visit www.vaccinesnh.gov to find a location where the boosters can be provided, as well as the vaccines for those that are 5 and up. We're also offering vaccinations at our clinic site at 18 Mulberry Street on Tuesday evenings during our vaccination clinics from 4 to 7, on Wednesdays between the hours of 10 and 12, and again on Fridays from 8 to 12. So there's opportunities for our kids to go ahead and get their vaccinations. We do want to ask our community to work together with us. The public's health is all of our responsibility. Let's make a commitment to stop the spread of COVID-19. Let's wear our well-fitted masks in indoor public settings. Let's go ahead and get vaccinated and get the boosters as well, because that's going to offer you the highest level of protection from your vaccines. If you're sick, we're asking folks to stay at home. And if you develop any symptoms, or if you've been in contact with a case, even if you're vaccinated, get tested. 5 days after contact or exposure, please get tested. If you have symptoms, you can test right away. Continue to maintain safe distancing. Wearing our masks is really important. That social distancing is also very, very important to reduce the amount of viral droplets that can be picked up. And wash your hands often. We have another announcement to just make an update. Free COVID testing has been offered in Nashua. It was at 261 Lake Street. That site is now changing, and that will be at 25 Crown Street. That will be the new location. The same hours from 9 to 3, 7 days a week will be available. And so we want to remind folks that the location will be changing. You can also get testing through Rite Aid, Walgreens, CVS, and some of the other pharmacies. And if you're symptomatic, it's free. So please contact these pharmacies, schedule your appointment on their websites. You can contact our health department as well for more information about testing. The state is also offering home PCR tests as well as rapid tests. You can go on and order at www.covid19.nh.gov. So we're encouraging people to take advantage of all the resources that are available to them so that you can get tested, know your status. The sooner you know your status, the quicker you can quarantine or isolate if you need to, and the quicker you can also get back to work. In addition, we have our COVID-19 resources. These are numbers that you can call for more information at the state, on our Nashua, our COVID hotline number, which is 603-589-3456. If you have any questions, any concerns about the vaccine, about testing, please do give us a call. And we also have the resource here for information that's provided by the CDC and also by the FDA. The better informed our community is, the better choices we can make to maintain the health and well-being of our community, our family, our friends, and our coworkers. Let's continue to be a part of the solution. Get vaccinated, wear your mask, a well-fitted mask, maintain your social distancing, and wash your hands often. And if you develop any signs or symptoms or come in contact to a case, please do go and get tested. Our contact information is on this slide. We wish you the best of health as we continue to all work together to overcome COVID. Thank you.